Do you have submental fat or a double chin? Well, if you do, then I've got some great solutions in this pre-consultation video. Well, let's get started by talking a bit about the anatomy of the submental fat and the double chin. Now, there are two causes of submental fat in the double chin. Basically, there are two layers of fat in this area, and we're talking about this area below your chin and above basically your Adam's apple. There's fat that is in the subcutaneous layer, and this is fat below the skin and above the muscle layer. We have a muscle called the platysma that's a sheet-like muscle that comes up the neck. So subcutaneous fat is fat below the skin but above that muscle. The deep fat is fat that is below that muscle, and that fat can be around certain inner organs of the neck as well. So how do you tell what type of fat you have? Because some people have mainly subcutaneous fat, other people have a mixture of subcutaneous and deep fat, and they're treated very differently. Well, the best way to tell if you've got subcutaneous or deep fat is to do what I call the Grimace test. And the Grimace test is when you are relaxed, take a mental note and pinch that skin and the fat under your neck and take a mental note of how much is there. Okay, and when you're relaxed, kind of pinch it and see how much is there. Okay, this is how much is there. And then I want you to grimace real tight, like this. And what you want to do is you really want to tighten up that neck. And what you're doing when you tighten the neck up is you're taking that platysma and you're tightening and lifting that platysma up. And when you are nice and tight, then take a pinch of the neck skin and see how much fat is there, okay? If when you pinch it when you're relaxed, you have a lot there, and then when you grimace, you pinch it and there's the same amount, then that's a good sign because that means that what you're pinching technically is just skin and subcutaneous fat. And that's much easier to treat than deep fat. If, however, when you grimace, you can't pinch a whole lot, but when you're relaxed, you can pinch a lot, then that means that when you're relaxed, you're pinching a combination of skin, subcutaneous fat, but you're also pinching muscle and potentially even the deep fat. When you grimace, that muscle tightens, and if you can't pinch a whole lot, it means that most of what you were grabbing here when you were relaxed was muscle and deep fat. That's much harder to treat. Okay, so the Grimace test will tell you whether it's going to be an easy way to get rid of that fat or whether it's going to be hard. If it's mainly subcutaneous fat, that's much easier to treat than if it's mainly deep fat. So I hope that makes sense to you. But basically, it's the Grimace test trying to do a pinch test on whether it's subcutaneous, easy to remove fat, or deep, hard to remove fat. Now, if you've got an issue with subcutaneous fat, then that's what liposuction can get for you. So this is called submental liposuction, or I nickname it a weekend neck lift because it's so simple. So what it is we do put you typically under a general anesthesia, and then I make a little nick incision right in the crease underneath your chin. Then I inject an anesthetic solution into that area that will limit bleeding. Give it a few minutes, and then literally using a liposuction cannula, we basically just suck that fat out. Now sometimes we'll also make a little incision behind each earlobe as well so that we can liposuction from the side. But I only typically do that in people who have quite heavy necks. Usually that's not necessary to give you those scars back there. Okay, so most of the time just a little nick incision down here, and we can kind of fan out that liposuction to get rid of that fat. Afterwards, there's typically one little stitch here, and if we have the ones in back, we'll put a little stitch back there as well. Then we put some cotton gauze here and a kind of an elastic facial wrap that you wear afterwards. The procedure takes about 45 minutes. After surgery, you go to the recovery room for about a half hour to an hour, and then you head home. This is typically not a painful surgery. Most patients don't take any pain pills with this type of a thing. The day after surgery, you can take the wrap down, you can get in the shower, shampoo your hair, that type of thing, pat it dry, and put the wrap back on. Now you will have some swelling and you will probably have some bruising right afterwards. You can drive a car probably the next day without a problem. You come back to see us at a week, although you try to wear that facial wrap the first week. At a week, you come in, we take the little stitches out, make sure everything looks good. At that point, you will be a bit swollen. And what a lot of people find is that what they see right when that dressing is first taken off that first day is pretty close to what they're going to get when all that swelling goes away. But usually at 1 to 2 weeks, you're at maximal swelling, and you may even look at it and say, Dr. Yoon, I don't even think you did anything because it looks the same as how I started. Well, don't worry. How it looks like the first time you take that dressing off is going to be much more accurate of a estimation of what you're going to get in the end. So once again, you come back in a week, we take your stitches out. You don't have to wear the facial wrap after that. It will take we will get you back to exercising after about 2 to 3 weeks. It will take about 6 to 8 weeks for most of that swelling to go away. It takes about 2 to 3 weeks for the bruising to go away, but about 6 to 8 weeks for most of the swelling. But it can take a total of 4 to 6 months for all that swelling to disappear. Okay, so even though the procedure is real simple, you can see results very quickly, it can take several months for all the bruising to go away. Now, the risks with the liposuction are pretty minimal. There's always a risk of bleeding, which is a blood collection, not common, but always possible. Much more higher risk of that in men than in women. There's a risk of scarring. You're going to have that scar. It's possible that scar could turn into a little keloid or a little thick scar. Pretty unlikely, but you just never know. Okay, we recommend scar creams over that starting about 2 to 3 weeks after surgery. There's risks of unevenness. You may find unevenness down through here just because liposuction, unfortunately, is not the most accurate surgery. There's risks of infection, which is extremely small. There's risks that you may have some loose skin afterwards. Okay, so liposuction really is best done. Excuse me. Liposuction is really best done in somebody who has good skin tone. Somebody anywhere in their 20s, 30s, and 40s, typically it works well. We do it sometimes in people in their 50s, but then you start worrying about loose skin, okay? So it can make loose skin even looser as you take that fat out. There's always a risk that one area may look a little bit smoother or a little fuller than the other side. There's always a risk of some minor asymmetries there. It's very common to get some initial numbness, although that typically goes away in just about everybody. There is also a risk of damage to a motor nerve. There's a nerve called the facial nerve that comes right along the jawline that goes to the corner of the mouth, and it's possible for that nerve to get damaged. Now, it's much more likely if a doctor tries to liposuction your jowl or go above your actual mandibular border or your jawline to try to jowl in that try to liposuction in that jowl area, because that nerve comes right up through there. And I've seen another surgeon hit that nerve before, which is not pretty. And because of that, I really stay down underneath the jawline when we do the submental liposuction. There are other risks, but these are kind of the main ones that we look at. And during a face-to-face consultation and in the preoperative appointment, we will go over the other less common types of risks of submental liposuction. Let's take a peek at some results. As you can see, this patient had liposuction, a really nice improvement, one of my favorite results that I've had just with the submental liposuction. This is another patient before and after. You can see a real nice change. And what people find is that some of us, we find that we've got this double chin and it makes us look and feel heavier than we really are. And so what you find if you do lipo here is people afterwards don't say, oh, look, you had your neck lifted or you had plastic surgery. Most likely what they're going to say is, wow, have you lost weight? Because a lot of times getting rid of that puffiness, that double chin, makes us look like we've lost weight. Our face looks thinner and lighter. Another example is somebody who had a bit of a heavier neck, did some liposuction to get rid of that excess fat. So lipo is a great treatment. Literally takes about a half hour, 45 minutes. Very simple. If you're looking for a kind of a quick thing, get it done and be done with it, then that submental liposuction, the weekend neck lift, can be very, very effective at doing that. The group it doesn't work for are people who have looseness as well. So if you've got fat there, but things are also sagging because the skin has gotten saggy, then we'll talk about how to treat that in a minute here. Well, the great thing is, as of just about two years ago or so, is you can get rid of that double chin fat now without having surgery. So Kybella is a great treatment nowadays that we're using at YPS to get rid of the double chin. And this is a FDA-approved injectable substance that's composed of deoxycholic acid. And this is a naturally occurring substance in our GI tract that will actually dissolve away fat. And so it's been formulated as a commercially or physician available injection to inject into the fat underneath the chin, the submental or double chin fat, to melt away that fat. Okay, The treatment is very simple. It's done in the office. We measure the area out. There's tiny little dots that we put there, and it's multiple tiny injections, typically anywhere from 10 to 20 injections with the tiniest needle to melt that fat away. Okay. Typically, there is some burning right after the treatment, and because of that, I will inject anesthetic around the area that we inject the Kybella, so hopefully you don't feel any of that burning. So we do the treatment. The actual injections take literally 3 minutes, and you're done. There's a little bit of a burning sensation potentially, unless you're completely numbed up, which happens quite often. We put some ice there, and then you head home. Now the area will swell a bit because Kybella is inflammatory. It does destroy that fat. So the area then will swell for a couple of weeks, up to a month. I've seen rare cases up to 6 weeks of swelling. And then you come back typically anywhere from 1 to 2 months later for another treatment. It does take anywhere from 2 to 4 treatments to get maximal results with Kybella. And what we have seen is a vast majority of patients will see some change after 1 treatment. We'll really see things, just about everybody will really see things working great after 2, and then it just depends on how much of an improvement you need, whether you need 3 or 4 treatments. We'll talk about the cost at the end of this pre-consultation. The one negative with Kybella, the great thing with Kybella is it's non-surgical and it really does work to dissolve away that double chin fat. The negatives is it does take multiple treatments and that can get somewhat expensive. But if you're the type of person that you've got that double chin and you want to get rid of it and you don't want to go under the knife, you don't want to take time off of work, you don't want this general anesthesia, then Kybella is a great option for you. A lot of men are having it done. Now, what are the risks with Kybella? The main risks are things are more side effects than anything. So you're going to get some swelling. You can get some numbness. The area can get some bruising there. That typically all goes away. There is a risk, and in the study, they did show some people who had potential injury to the motor nerve, creating a crooked smile. But that's why we stay far away from where that nerve is, and typically that's not much of an issue. Kybella also does not tighten up the skin, although I do believe that the inflammatory process of Kybella can cause that skin to retract a bit better than liposuction. So if you've got a little bit of loose skin, I would probably choose Kybella myself over liposuction because you get the benefit of that inflammatory process that may cause that skin to retract and tighten up a little bit more. And you can see here a nice before and after picture of somebody who's had the Kybella injections. Let's take another look at a before and after. You can see this is from the Kybella website. A nice improvement with the Kybella injections. And once again, a lot of men are having Kybella done. So this is really, I think, a game changer in the field of plastic surgery because now we can melt fat away using a simple injection. And at this point, it's FDA approved just for the double chin area. So that's what we typically use it for. Well, what if you've got a double chin, but you've also got some loose skin that comes with it? Well, in that case, I don't necessarily recommend Kybella or liposuction. Unfortunately, you got to consider a lower facelift. So if you are in your minimum, mid to late 40s or older, and you've got the heaviness, the double chin, but now things are starting to droop as you get older, then unfortunately the better option is to do a lower facelift. That does create permanent scars around the ears. It's about a 3 to 4 hour operation. I'll show you another picture here. If you're kind of more along these lines, then don't waste your money on Kybella or lipo. You got to consider going straight to a facelift. And if you want to learn more about a lower facelift, I go in depth exactly into that surgery of what you can expect, how the surgery works in the segment here on the lower face portion of, and you'll look up sagging or lax neck skin, sagging neck skin, and I'll go over all the details of the lower facelift with you. Otherwise, if your issue mainly is a double chin and submental fat and that skin is good, then you've got the options of 2. You can do lipo, which is a one-time, get it done, have surgery, get rid of that fat right away, or you can say, look, I don't want surgery. Let's go with the Kybella, which is a couple, 2 to 4 treatments in office. It does cost some money, but it really saves you from going under the knife. Well, thank you for watching. I hope this has been very helpful for you in your quest to get rid of that double chin.